Thank you for joining us this evening. This is the fourth MCW Community Town Hall. I'm Chris Miskell, a board member at MCW and the president and CEO of Versity, which is previously the Blood Center of Wisconsin. I'd like to point out that the handouts that you'll see today are also available in the handout tab in the webinar. We continue to face unprecedented times as a community. We're all in this together and need to lean into the resources that we have available to us. The Medical College of Wisconsin brings a wealth of up-to-date health and healthcare information and tips to stay safe, and they are investing in the community. Through the Advancing a Healthier Wisconsin Endowment, MCW is investing $48 million statewide to stop the spread of COVID-19. Some of this funding is going to support a breakthrough plasma treatment for the most critically ill COVID-19 patients. If you can advance the slide to slide 2, that would be good. The process behind this therapy involves extracting antibodies from plasma of blood donated from recovered COVID-19 patients. Those antibodies are then infused into patients currently battling COVID-19 to help their immune system fight the virus. This is an active team effort. While MCW is taking the lead on the research and on researching the effectiveness of this novel treatment, and Freighter is managing the care of the patients, Versity is actively recruiting donors of plasma. And in fact, Versity was among the first in the US to begin collecting convalescent plasma. I share this with you as an example of the life-saving work going on right here in Milwaukee, and also to give hope that there are therapies and treatments in development. We ask that you help us with this and share the information you get here, access the information on our website, and make sure that this critical information is reaching the people who need it. So tonight I'm really excited because we have a great slate of individuals to bring you expertise and their expert perspectives, key information, and to answer any questions that you may have. Dr. Joyce Sanchez is an infectious disease physician with MCW. Dr. Leonard Aghetti is the director for Center for Advancing Population Science at MCW. Dr. Erica Arrington is the assistant professor and child and adolescent psychiatrist at MCW. She's also the program director for the Child and Adolescent Psychiatry Fellowship Program at MCW. And finally, Dr. Kwaku Smith, a licensed psychologist and owner of Blacksmith Psychological Consultative Services. So with that, I'll turn it over to Dr. Sanchez.
Thank you. So I'm going to turn your attention to the status of coronavirus, both in Milwaukee and in the state of Wisconsin. Milwaukee, as of today, has 2,191 cases reported. When we look at the daily growth rate since March 12th, that puts us at 6.1%. However, the rate has decreased to 4% when we look at the past 7 days. In terms of Wisconsin, as of today, we've had 4,499 cases reported. And that daily growth rate since March 12th was about 6.7%. And that rate has also declined to 3.3 when you look at the growth rate in the past 7 days. Because these growth rates are significantly lower the past week and over the course of the past 2 weeks, this is really encouraging data. And it tells us two things. First, coronavirus continues to spread throughout Milwaukee and the state as testing capacity increases. However, the impact of safer at home measures is clearly being seen as the daily growth rate and doubling times have been set steadily decreasing despite that increased testing capacity. So it means that our interventions like safer at home are working, but also shows that we need to continue to follow these guidelines to see it to fruition. Next slide, please. This graph shows the daily incidence of COVID-19 reported cases since the state began tracking, and each bar is the number of new cases per day. And it visually shows that at the middle of March, you saw a steady increase in the number of reported cases, but throughout the month of April, we've really been doing a great job flattening the curve. However, because we're not seeing it consistently trending down yet, there's still work to be done. Next slide, please. So as we look forward to coming out of this crisis, we need to continue to follow a few of the guidelines in place in order to ensure that these numbers stay low. The first being washing your hands in the house regularly, keeping a distance of 6 feet as much as possible, particularly in public places. Now, if someone in your household is sick, if possible, trying to confine them to their own space separate from the rest of the family is advisable. Ensuring that you're cleaning all high-touch surfaces and regularly washing dishes and clothes and linens, especially as they're used by a sick family member regularly. Don't touch your face, and as mentioned earlier today, don't touch your, please share information. As always, use face coverings, including those who are in any period of sickness. Now, if you do have to regularly go out, try to wash your clothes and any cloth face coverings after each use, leaving your outdoor shoes outside if that's possible, and washing your hands immediately upon getting home before you remove your face covering. Remember, these measures are in place to protect you, they're in place to protect your loved ones, and then the people that you encounter. Next, I'd like to hand it over to Dr. Leonard Aghetti.
All right, thank you, Dr. Sanchez. So I am going to be talking about the next set of slides. The first one is about health and safety needs before relaxing guidelines. We get a lot of questions from community members and from individuals who are asking the question, do we really need all of these restrictions? Can we relax the guidelines? And I think it's really important to understand the underlying reason for these restrictions. The restrictions are in place to protect everyone and really to flatten the curve and slow the progression of disease. So what are some of the things we will be looking for before we make a determination if it's appropriate to relax the guidelines? The first is reduction of new cases over a 14-day period. As everyone knows, or as people may not be aware, it takes about 14 days for this infection. If you are infected, it takes about 14 days for symptoms for you to become non-infectious. So being able to have a reduction in overall cases across the state over a 14-day period is going to be important. The next thing that is really important is testing that's available for all individuals with COVID-19 symptoms. Right now, we are challenged with the availability of testing, and we're expecting that as the weeks go by, as we get more testing available, we will be able to test everyone who needs to be tested, and that will allow us to identify people who are potentially infectious. The next important point is the ability for hospitals to care for all individuals who need hospitalization. Obviously, we can handle a surge in cases even with all the resources we have across the state. So the idea behind all of these measures are really to slow the process so that when infection comes in, we have the resources, we have the ICU beds, we have the ventilators to manage individuals who come in. And then the other point is protective equipment that's available for individuals working in public places. So that includes healthcare providers, first responders, and all of those individuals who are providing services right now who may be at risk. Once we have a handle on these 4 areas, then it will be time to start asking the question, should we relax the guidelines? Next slide, please. So what lies ahead? I think people need to understand that we have a new normal. From all indications, COVID-19 is not going to disappear overnight. We're talking about hunkering down for the next 18 to 24 months. And so what do we need to do as we go ahead? One is the need for a gradual or phased relaxation of social parameters. So after the safer at home restrictions end, we have to kind of slowly ease in some of this, relax some of these guidelines, and that may actually require a coordination between CDC, the state, and then many of the other agencies that are making decisions about this process. The second thing that's really important is that there's going to be a need for continued health and safety practices. So we are not going to stop what we're doing right now because the cases go down. We expect people to continue to do hand washing, not to touch your face, staying 6 feet apart, and wearing face covering when you are outside of your home as much as possible, especially when you're in an environment where you're going to be close to people. So all of these measures are going to be the status quo for us going forward. I don't expect us to assume, but I want people to understand that we can't assume that because the numbers are going down, that all of these things we've done to mitigate the spread, that we're actually going to relax them and then give them up. We need to really slow this process down and ensure that it stays down for the next 18 to 24 months. Next slide. So now we're transitioning to the next presenter.
Yes, hi. Thank you, Dr. Ageti. I'm Dr. Arrington. In times of stress and uncertainty, a number of strategies can be helpful for maintaining well-being, decreasing or preventing depressive and anxiety-related symptoms, as well as other mental health disorders, and overall promote social connectedness and lend to resilience during these tough times. Stay connected, even while we have to stay apart. Reach out to friends and family. Arrange virtual dinner dates, game nights, and happy hours. Let others know that you care about them and value them. Spend quality time with people in your home. Of course, you're spending lots of time together, but it's important to actually engage with each other. Play games, do puzzles, cook together, and talk. Consider doing acts of kindness, giving blood, or something as simple as giving thanks to others. Next slide, please. Routines are comforting. They reinforce a sense of control. Keep up your daily schedule for waking up, personal care, eating, sleeping, and other activities. Make sure to move. Physical activity is key to mental well-being. This can be exercising in your home, going out for a walk or run, or dancing in your living room. And finally, most of us are feeling a huge range of emotions right now. This is normal. Take the time to check in on your feelings, acknowledge them, and process them. Next slide, please. Supporting loved ones who are struggling and services to use when you feel you need to seek professional help are available. The Ptosis Center, which is where the Department of Psychiatry and Behavioral Health is located, is now open to telehealth services, which include both virtual video visits as well as telephone visits. These services include outpatient mental health care, employee clinics, student behavioral health, adult ADHD coping clinics, adolescent clinic, as well as a psychiatry-run outpatient clinic. So we are up and running to take care of you and your needs at this time. There's also clinics open for children who are coping with crisis. Again, telehealth services, both telephone and virtual visits, are available through the Child Psychiatry Division at MCW. It's for both psychiatrist service as well as therapy appointments. If you're an adult and you need to make an appointment, please call the Ptosis Center at 414-955-8900. If this is for your child, please don't feel free to make an appointment for, again, telehealth visits at 414-266-2932. There will also be a number of resources available to you and sent out to all registrants to obtain services as well as educational material for mindfulness and other forms of therapy and physical activity. Next, I'd like to turn it over to Dr. Smith. Thank you.
Thank you very much, Dr. Arrington. Because a lot of the information that we say would overlap, I want to take it to a different type of level, because all of the information that you just heard is the practical information that we need. But sometimes in these uncertain times, it's the practical information that gives us that guidance that we can go forward. But sometimes from a theoretical standpoint, it can confuse us a little bit because we know the things we're supposed to do, but yet we feel some type of angst that we just cannot articulate. Specifically, the people you'll see on the screen, they go through all of the same things that was just described. So how do we really deal with everything that's going on at the moment? Whenever you're dealing with something with significant depression, it's usually because we're thinking about the past, what has happened. One thing that we haven't mentioned yet is the Adverse Childhood Experience Study. And inside of the study, it talks about the different things that we went through as children, how it can affect on us as children, into different things to a points to even an early death through dysfunctional coping mechanisms. And why is this important? Because even as we deal with COVID-19, we still have to recognize that people are dealing with experiences well before that. So we have to keep in mind that's where our depression can come. So even though we're dealing with COVID, we have to make sure we stay aware of those other things that was hurting us before. But then also we have a lot of people who's dealing with anxiety. And anxiety is generally a feeling, and when you're talking about you're afraid of the future. And we know most of the fears that we have is not even going to be realized. But what we have to recognize inside of this is this: every time we have those fears and we feed into them, we stress our immune system. So when those things do happen, if they do, possibly, we've already utilized our immune system to a point where we've overtaxed it. So we want to be careful. So we want to put our attention on the present. Even though it's difficult not to think about the past and it's difficult not to think about the future, we want to put our money where it's best used, and that's on the present, being mindful, being considerate of the things that's going on exactly at the point. And if we take our preference from the CDC, we also understand that they do things from three measures: from a prevention, a secondary, and a tertiary. So if we're in the moment when we're thinking about a tertiary, we're saying, hey, I'm caught up in this. I'm economically strapped. I'm dealing with situations where a loved one I have is feeling the pain. I'm a parent and I'm struggling with trying to work from home, dealing with my students, my children who are now my students, and dealing with just all of the other issues going on. What do I do? What are those realistic capabilities when I've used all of these things that you said to do and they don't work? Well, this is why we're here today, to talk about those questions so we can give you specific questions, specific answers to your specific questions. Now, when we think about what are we doing from a secondary standpoint, these are the individuals who we know are going through something. So how can we be helpful to those people who are serving as heroes? How can we be helpful to those who have been directly affected by COVID-19? And most importantly, as we think about a proactive and prevention measure, what we have to consider is this: how do we deal with this going forward from what we learned? As Dr. Ngeti stated, this is something that we could be dealing with for the next 18 to 24 months. What if this is not only the only strand? What if this is not the only other virus that will come up? So what are we learning from this? So how we can be proactive and preventative in the nature and the things that we do. The key to this is having a power positive thinking. Oftentimes when we deal with all of the things that we're dealing with, is very much concerned about where our brain and our mental activity is centered towards. So the more we can stay positive and focus on the things in which we can control, the more we have initial power to be able to control those issues. So as we think about where we want to go to into this whole COVID-19, what we have to be is very realistic. We have to think about, we talk about a new normal, but in this new normal, we have to ask, was our old normal actually normal? So this is a time not only for us to think about how we can improve, how we can deal with today, but when we start to go back to a different sense of normalcy, how can we even improve upon this society that we were dealing with before COVID-19? So as we go into the next area of this phase and ask your questions and answers, we invite you to ask questions that are not just there from a practical session, from a theoretical standpoint, as I said on surface, but let's dig deeper into the practical, because the more real we are with our questions, the more we can get through this together. We all have fears, we all have a bit of anxiety, but working together, we can reduce them, we can calm them down, and we can get through this. We've looked throughout the history of our nation, throughout the history of the world. There have been viruses, there have been pandemics, and they've all come down. So if we recognize that we've not been through this as a people together, but the world has been through this, we know we can get through this, and we know we will get through it, but we get through it by thinking positive and doing it together.
Great. Thanks, Kweku. Well, I think we're at the point where we're going to move to Q&A.
Yes, thank you, panelists. We're going to enter a time of question and answer now. So if you would like to submit a question for our panelists this evening, just locate the question panel in the webinar and you can submit the question and we will get to as many as we possibly can. Before we get started, just one correction from earlier. MCW has invested in the Advancing a Healthier Wisconsin Endowment 4.8 million, not 48. 4.8 million, not 48. Okay, so here we go with the first question, and that is, if a sick family member cannot isolate themselves, how can I protect myself and others in the household?
Well, I can start mostly because it's stuff that we've dealt with and something that I've covered over in the slides. I recognize not everybody can be isolated depending on how your household is structured, the number of individuals, and just in general how life goes. Having 2 kids, I know how that goes. If I got sick, it'd be very, very hard to do that realistically. But a couple of things that you can do: that sick household member should be wearing some kind of covering, cloth covering, particularly when it's not practical to stay 6 feet away from other individuals. And if they have a certain area of the house that they can be confined to, even if it's not their own room, their own bathroom, but so, a small corner somewhere, rearranging a bed or a cot or somewhere where they can be. That way you can minimize the traffic going to and from that section or that corner of the house.
And also, if I could just add to that, Dr. Sanchez, because those are great points. But we recognize, obviously, with the way that this virus is transmitted, that things can happen. And if one person in the family gets it, it's a great likelihood someone else is going to get it. So with that type of information, we also want to alert people as we talk about thinking proactively. What if one person has it, we start to create a plan for the other family members. What would we do if someone else gets it? So if there are children, who's the oldest, who's the most responsible, that we can get things done? Do we have enough food to make sure that we can maintain? Start to think about different ways in which the house can function if it becomes into a manner in which we do not want, but the likelihood is there.
Yeah, and then also to add to that point, I think cleaning surfaces regularly is critical. We know that the virus stays on metal surfaces longer than other surfaces. So there should be a plan in place to clean on a regular basis, every couple of hours, wiping down surfaces, having like a schedule of cleaning, so that way, in addition to isolating the individual, making sure that people are wearing facial covering, at least you're also cleaning surfaces and minimizing the chance of spread.
Okay, next, another one about masks. I have made masks for myself. Will they actually protect me from the virus?
So I can take that question. The mask is not, the homemade mask or facial covering is not designed to protect you per se. It's really designed to minimize your chances of exposing other people to any kind of infection you have. On one level, it is better than having nothing, but it is not designed to actually protect you. That's why we talk about the N95 mask is what is really designed to actually prevent you from getting the virus, but that's not meant, that's only reserved for healthcare workers. So what the facial covering is doing for you is really, if everybody wears the facial covering, they are preventing spread for themselves to others, and it actually helps protect others around you.
Okay, next question. I heard that the more sick you get, the stronger your immune protection will be with respect to COVID. If most people don't get really sick, what level of immune protection can we actually expect?
I can take that. I think what we know about immune protection right now is limited. And just to be very transparent, we are still struggling with understanding how this virus functions. A lot of information we have right now is based on other viruses that are similar. They fall under the coronavirus group. So there's the idea that there might be some level of immunity. We don't know how long that immunity lasts. And I don't think it's dependent based on what we know. It's not so much dependent on how sick you get. It's more dependent on how your body reacts to the virus and how your immune system reacts to it. So I would say right now that it's not the correlation between how sick you get and whether you develop immunity, but it's also important to recognize we don't know whether that immunity is long-lasting, if it's a short period of immunity. We're hoping that it will have long-lasting effects, but we're not sure yet.
The next question is related to plasma or blood donation. If you suspect you had COVID-19, but a very mild version, will there be a way to test if you had it? If I can donate plasma, I'd like to, but if I didn't have it, then I'd like to donate blood.
Chris, are you going to?
I'm sorry, can you repeat that one?
Sure can. If you suspect you had COVID-19, but a very mild version, will there be a way to test if you had it? I can donate plasma if I can donate plasma, I'd like to, but if I didn't have it, then I'd like to donate blood.
Right. Yeah, so I think that the thing that, first of all, I appreciate the interest in folks wanting to come and do something kind to help others. So from a Versity standpoint, we do not have a test currently. The way that we would, we'd ask a standard set of questions of folks, inclusive of their health, and our medical folks could give you a better answer than I could, but essentially there are certain things that would determine whether or not you're included or not in terms of an ability to donate. If you have not been diagnosed by a lab test, but you're feeling like you have clinical symptoms, we would probably encourage you to wait a couple of weeks. And if you're not feeling well, then to try to get some kind of laboratory test prior to donating.
Yeah,
We try to go more on the conservative side than the aggressive side, just out of protection to the folks that are on the other side of that, on the recipient side of the plasma.
So let me just also weigh in, thanks for that update. So in terms of, there are two possible options that we have right now, and we're trying to figure it out. One of them is antibody testing. So I think right now, Fredet is, the lab is about ready to be able to deploy a serum antibody test that allows you to identify people who have been exposed to the virus, but who are no longer sick. If that test pans out as is expected, we might be able to offer that test to identify individuals who have prior exposure but who are actually well now. Those are the kind of individuals who have antibodies to the virus, who may be able to donate plasma. The second group are those who have been tested positive. They know they had the virus, they've recovered from the virus, and they're at the point now where they have been symptom-free for about 14 days. Those individuals are also individuals who may be helpful in terms of being tested to see if they have antibodies and who can actually donate and support those who are sick. So, and if you've never been tested, you're not sick, you've not been tested, then a series of questions can screen out whether you have been exposed to the virus. If you're not, you might be able to donate blood to help those who are sick.
Yeah. Thanks, Dr. Agetti. I mean, I think the important part, so you answered that much better than I would. The important part for the convalescent plasma study is, to Dr. Agetti's point, there has to have been a confirmed lab test that said that you had the virus, and then there has to be a period of time where you're symptom-free. And then once those things happen, along with some confirmation from a licensed medical professional, then you can go into the convalescent plasma study.
Okay, thank you. Next question. Is there a dedicated phone number for people to call if they think they have COVID-19 and they want to get tested?
I can answer that. If you have a primary care physician or primary care provider of some sort, I would always start with that person. For individuals who don't have that as a luxury, the Medical College of Wisconsin does have a general line, and they will have someone on the other end to answer questions and help steer you in the right direction. And that number is 414-805-2000.
But also you have the option of calling 211, and that's also your primary care doctor probably knows you the best. So if you're sick, that's probably where you want to call first. Like Dr. Sanchez said, if you don't have a primary care doctor, you should probably start with 211, because that will get you to a line that can actually then triage you and help you identify the closest place to get tested. And then if that option is not available to you, then calling the Fredet and MCW line, that would also be your another option.
Okay, next, how do we provide emotional support to class of 2020 high school students who are frustrated and or possibly depressed because what should have been an amazing year is falling apart? Canceled prom, class trips, hanging with friends before heading off to college, graduations, etc.
Yeah, so I can start on this, and then I would imagine some others are going to peep in on this. I'm also contracted at the University of Wisconsin at Madison with the Badgers, and in working not only with college seniors and high school seniors, it's a very difficult time. And so what we have to do is let them recognize, one, that it is an unprecedented time. But the second thing is to let them know that it's not exactly ruined. Because as we've been seeing, there's been some very, very creative ways in which people are trying to do some things to still help salvage what is that of their senior year. And so when we start thinking about that, what we want to do is now to become very creative. And what are some ways in which we can do? I've seen some schools do some really magnificent things to still say, how will we keep our graduation together there's an online petition for Barack Obama to actually do an overall commencement speech for the college students so they can come together in a large Zoom call together. But as we speak about it, one, we let them know for the pain that they feel, it's okay to feel that hurt, that that's normal, that they can be upset. But the second thing is, with that upsetness, instead of using it for something destructive, how can we use it again for our creative juices to be able to figure out what we can do, how we can salvage some parts of it, and then also working with the schools and to see how some things can be delayed, some things can still be put on, even though not at the regular time, but in a different time in which you can still experience some of those great things that's associated with your senior year.
Yes, I completely agree with Dr. Smith. These are major milestones in our lives that we have wonderful, cherished memories that unfortunately the graduating class of this year from high school, from colleges, from medical school, from middle school, elementary school, everyone's feeling a sense of loss in terms of being able to celebrate these wonderful milestones in our lives. You know, first and foremost, families, communities, schools acknowledging that this is a loss, and then checking in with children to understand what is that loss meaning to them, watching them just to see how they are interacting with their environment, if there's a change in how they're communicating, if they're isolating, if they're saying they're sad, if they're feeling disconnected. All these different things are coming to surface because of such a loss. Unfortunately, this is going to occur for the goodness of the population and the goodness for all, but acknowledging first and foremost, looking for changes in behavior and changes of sleep patterns, eating patterns, engaging with other patterns, just watching and monitoring them and getting any type of professional help that they may need, because again, this is a significant loss of a major milestone in life.
And kind of following up to that, so just beyond the class of 2020, what about students of all grades and all types? Are there any ideas and thoughts on how to support their overall well-being as they have transitioned their learning environments from in the classroom to virtual? Especially if they're still being told that they need to be as equally productive as they were before in such an unprecedented time?
Yes, and I think this is something that we really have to talk about. We talk about going from theoretical to practical. We understand what the summer slide means to so many of our students. And now when you think about what's going to be compounded on this from our early exit from the school, is absolutely horrifying for a lot of students and for a lot of parents. So what we have to do is to think about what can we do again now to make schooling very interesting. And two, to the point of that question, is recognize that everybody's going to be on a different scale. Sometimes a child is not going to want to work. This is not a time to punish, but a time to understand and see what's going on. We have to understand that we have to have relaxed kind of schedules in which we work. Children are in school for approximately 6 hours of the day, but they're not working those full 6 hours. So we want to also talk about how can we become even more creative in our teaching. Schools sometimes have been kind of forced to deal with the 3 R's. So this is a good time for us now to teach those interact and those interpersonal skills, to start to teach things even more vividly on citizenship, to start to do interactive things with gardening, with planning, those things that we can do, those things that we can't control that can still help them, not only from an academic standpoint, but that can help them as it relates to just the holistic growth of the person. So what we want to do as parents, as educators, is to become very creative. Obviously, there's some people who's able to do some things through virtual learning. So that's something to be that we can take advantage of. But for those who can't do it, now parents, now other family members have to become very creative in what we do. But most importantly, to the parents, this is a time to give understanding, to give patience, and to become very creative with your students. There's things that can be done through public television. There's things that can be done through the local schools with packets that's given out. But also, this is a time for homeschooling to come out, like I said, in manners which are usually non-traditional in the average school, but that could be very beneficial for those in other aspects of life.
I would also like to add to Dr. Smith's statements that this change was so abrupt, and that families, parents, and guardians all of a sudden became teachers. And this is a new day, a new environment, and a new way of practice. This has changed families' homes and work life of parents and guardians and loved ones and family members, and also how children engage with these persons in terms of how to get through the school system. So it's not just a stress and burden on the kids. We definitely acknowledge that, but it's also a stress and a burden and a change for families in general and for parents and guardians at large.
Okay, thank you. Turning to end of life, should people be encouraged to discuss their final wishes and consider creating an advance directive if they do not already have one in place? Advance directives are important, but I would think they are especially relevant considering our new normal with COVID-19.
So I'll start. I do think regardless of COVID-19, people should have those conversations ahead of time. It's usually not ideal to be having that first conversation when you're in the ICU, when you're barely conscious. So I think regardless of COVID-19, I think what COVID-19 has brought to the forefront right now is the importance of really establishing having those conversations at home with your loved ones ahead of time. Having said that, if based on where we are right now, I do think it's critical for people to be very clear about what their wishes are ahead of time. So if you haven't had that conversation with family members, this is the time to say, just in case something happens, we're not assuming it's going to happen to you, but just in case it happens, here are the things I would like to get done. Whether you have a document or not, that's going to be a personal decision, but at the very minimum, having those wishes outlined ahead of time will be very, very critical.
I can speak a little bit about that too. I know it can be very, very daunting when you're thinking about medical decisions and the little nuances. If I get put on a ventilator, how many days do I want to be on? Or if my heart stops, do I want CPR to be performed? You don't necessarily don't let all of those details prevent you from at least naming a person to make those decisions for you if it comes to it. And then making that known to the person, having a conversation, frankly, and it doesn't have to be detailed if that's overwhelming. But at least having one person named and documenting that, I think, is actually quite important, particularly if they're not a spouse or someone who would legally be the natural person to go to.
And because this is such a taboo topic, what we have to recognize is also the practical value. From a fiscal standpoint, it can be fiscally advantageous to take care of these things beforehand, because now you're not dealing with up close closing costs right away, and you can do it before the emotional standpoint comes in. So what we want to do is to think about something, how we can be proactive about this, how we can take care of our family, but also at a time where, because this is a taboo topic, this is something that's in our face, let's make sure we follow up on this, not just now, but that we continue these conversations as it goes on to help our families for our time after, when we go back to our regular normal SO.
Great, thank you. And then as a follow-up to that, how can we best support people who have lost loved ones during this time?
Yeah, as a clinician, this is one of the difficult things, because when we're dealing with grief, one of the big things that we do normally is what we come around together. We want to show that support. We want to give hugs. We have that proximity issue that comes around, and even inside of the funerals, with the laws and the orders that stands today, with there not being more than 10 people gathered, becomes very difficult. So this is again where it becomes a time that we become very, very creative. In some funerals homes, they're trying to do some things sort of like the old drive-in movie. So we want to be able to give them different things in which more people can come, where people can be safely in their cars, but still be able to view in a way in which they didn't before. But what we want to do is to acknowledge the pain, acknowledge the hurt, but make sure that we stay in constant communication. Oftentimes in periods of grief, people will be there for you the first week, maybe the second week, but then things kind of dissipate and go down. Where we want to make sure in this time, especially with social distancing, that we stay very much in contact through telephone, through technology, FaceTime, Zooms, things of that nature. But also we want to recognize that financially it could be a burden. So we want to think about how can we help. And whenever we think about how can we help, there's three ways in which we can do that. That's usually your time, your talent, and your treasure. So whether it's dropping off food, maybe giving a few extra funds, or maybe just giving your actual talent, something that can help them through the process is something that I think you should all consider, and something that we all need.
We just have to remember that social distancing does not have to equal social isolation. And during times of grief, it's very important that families and friends and loved ones stay connected in some way, shape, form, or fashion.
Okay, thank you. Is the current recommendation for all individuals to wear some type of face covering or mask at all times when leaving the house?
Well, if you look at the recommendations that are put forth by the Center for Disease Control and Prevention, or CDC, they recommend a cloth mask face covering in all public places where social distancing is difficult. They don't, at least last I checked, and they do update pretty regularly. If you're in a position where you're absolutely confident that you're not going to be within 6 feet of anyone else, which honestly is hard to predict, right? You can have all the greatest intentions, but we can only control what we can control. So for that reason, I would always at least have a cloth face covering on hand to put on my face if I find myself in a difficult situation where that's out of my control and I can't stay that 6 feet apart.
So one of the things, if you go around grocery stores right now, Walmart and most grocery stores, you find people congregating without paying attention to the six feet distance. And I think if we really want to help ourselves and help others, if you're going out to places like grocery stores, places where you're going to have a lot of people around you, you should wear a face covering. Now, obviously, if you're in an environment where you're going to be taking a walk and you're going to be by yourself, then maybe that may not be required. But if you're going to go into a place where you're going to encounter other people, where social distancing will be difficult, you should strongly consider wearing a mask or face covering.
Okay, next question. If individuals don't have access to cleaning products due to shortages in the community, can bleach and water be used?
Dr.
So
Sanchez?
yes, I don't know offhand what the ratio is. So yes, you can. Again, the Center for Disease Control and Prevention website, as well as the Wisconsin Department of Health Services. If you Google either one of those, as in addition to cleaning products or make your own cleaning products, if you go to one of those two websites, there will be links with a list of different things that you can either purchase or use yourself, including household bleach that you can dilute with water.
Okay, some questions about family members or healthcare workers that our folks might know. My family member is pregnant. Can I go see her and help her?
I think that goes back to the whole idea of the difference between social isolation and social distancing. So I would say definitely if you are sick or you have symptoms, you should not go. So that we know for a fact. If you're symptomatic, you have symptoms, you've been sick, you should not go. If you're not sick and you're able to do appropriate distancing, then yes, you can actually provide support, and preferably if you're wearing some kind of mask, that will be helpful, because there are going to be things that individual needs that you may be able to provide without having to do in very, very close contact, or even things that just being around, helping with things around the house may be very helpful if you do appropriate hand washing, appropriate cleaning, appropriate use of face covering. I think you can provide the support that is needed without being allowing that person to be isolated.
I would agree with that, and I think I'd actually extend that to other individuals who may be vulnerable, who don't have the support system in place. So you named the example of a pregnant individual, but it's someone who's elderly, who has lost somebody who has been taking care of them, or because of some of the restrictions or loss of employment, they have lost that support system. I think as long as you're following the recommendations that Dr. Aghetti has outlined to minimize any chance that you could put that individual at risk, I think that would be appropriate.
Okay, what type of self-care would you recommend for people who are working in the front offices of healthcare and seem overloaded with the constant flow of information and constant outreach?
Yeah, and that's probably the best question, because sometimes we tell people, hey, you want to get information, but you don't want to overload of information. But what happens when you cannot get away from it? So the first thing what we tell people is to recognize that, hey, I am in this situation. So the second thing what you do after that is figure out what are ways in which I can dispel this from my system. So having somebody to talk to be able to deal with this. Also finding different getaways once you are away from that situation to literally get away from it, to kind of refresh and to re-cleanse your mind. And third, one of the things we haven't talked about, but is a way for a person to come, and Dr. Joyce alluded to it just a little bit when we talked about the things we can do when we talk about eating right, we talk about nutrition, and we talk about sleeping. So we want to make sure that what we can do inside of our system is to make sure that we prepare our immune system by giving it rest. We prepare our immune system by keeping it as healthy as possible, but to make sure that we recognize that there is something and to talk to somebody so we don't carry that load all to ourselves. Dr. Arrington, I'm sure you have some other things to follow up with it, because you're in this area also.
Yes, I do. I think first, again, acknowledging to others around you that the influx of information that's constant and that's coming is becoming a bit overwhelming, and finding ways to respectfully pull yourself back from that information. Information overload can lead to more stress, more depression, symptoms, more anxiety, and more risk. Firstly. Secondly, taking care of yourself. There's, again, staying on a regimented schedule, like you were saying, sleep, watching your diet, what you're putting and what you're fueling your body makes a huge impact. And there's also different mindfulness techniques that one can use, meditation and other things, in order to help bring about a sense of balance in your life. And again, if things are becoming so overwhelming that different areas in your life are being overwhelmed and disturbed in terms of your sleep, your appetite, your overall sense of balance and well-being, and feelings that you feel you cannot necessarily manage with just pulling away and kind of putting the stops on the information overload that's coming, then please seek professional advice.
I'm just going to weigh in just for from going back to the idea of practical things. I have had to do a couple of things myself to manage the information overload. One is limiting the news. Just watching the news alone causes a lot of stress, and sometimes half of what you're watching are not relevant information. They're just things that are designed to cause more anxiety and concern. So I would say to people, pay attention to what you're watching and ask yourself, is this a reliable source of information? Secondly, focus on getting materials from reliable sources. So there are sources where when you get information, it's factual, it is based on available evidence, as opposed to things that are based on innuendos, suggestions, ideas that people have. So that also helps you focus on what is true. The third thing I've found is really paying attention to what is known and what is unknown. There are certain things we don't know, and you have no control over what you don't know. So what you can actually control is what you know. So manage what you can control, as opposed to paying attention to things you have no control over. So those are ways in which I've tried, and I think it's very practical in terms of trying to manage the overload of information that's out there.
Thank you. I've read that COVID-19 can lead to kidney failure. Are we seeing such cases in Wisconsin? How are we positioned for dialysis machines in addition to respirators?
So what we're seeing with COVID-19, there's obviously once you get to the point of the very sick individuals, what we're seeing is not just kidney failure; it's what we call multi-organ failure. What that means is that it starts off with your lungs, then your kidneys, then your heart begins to be affected. So it is not just that it's targeting just the kidney, and it's really the fact that it's targeting, it causes this level of organ shutdown where the kidney is probably hit very hard. So I think based on what is known right now, most of it is seen, most of the kidney failure is seen in people who are very, very sick, typically inpatient ICU. That's where a lot of the kidney failure is happening with COVID patients.
Next, a family member of mine has COVID. She no longer has the fever, but still doesn't have her senses of taste and smell. Based on previous cases, is there an idea of a timeline of when those senses might return?
Sure, I can speak to that. We're still gathering data as things come out, and the loss of taste and smell was a later phenomenon that had been going on since the beginning, but losing taste and smell aren't necessarily as easy to pick up as a drop in oxygenation. From what we know, mostly out of China and Europe, since they preceded our involvement in the United States, is that the loss of taste and smell can last for up to 2 to 3 weeks in some individuals. Whether or not it'll take that long to recover in any one individual, I think is very hard to predict. But it sounds like it's reversible.
Okay, we have received several questions about having to go back to work once the restrictions have lifted. So what can you say to people who are petrified of having to go back? Or should I go back if I'm scared?
No, that's, oh, go ahead, Doc.
No, I was
No, what I was going to say that it's a normal reaction to feel nervous and times of uncertainty and unknown expectations. Getting back to routine, getting back to your normal schedule, and getting back to your work life is going to be really important for you in order to maintain a sense of balance and a sense of improvement in all areas of your life. But it is natural to feel anxious and worried and concerned for going back.
So I was going to say that if we understand that we are going to have the coronavirus with us for probably the next 18 to 24 months, the question we really need to ask is, can I stay away from work for that period of time? And in practical terms, that is probably not realistic. And we also have to pay attention to the fact that 80% of cases of the infection are mild cases. So when we put things in perspective, with appropriate social distancing, appropriate hand washing, wearing face covering, the risk we can minimize the risks for at the individual level, that being able to go back to work once work reopens should not be as much of a concern as it is, because you are going to be exposed regardless of whether it's work or home because of the community spread. It's just taking appropriate precautions that we need to focus on going forward.
And one of the hard kind of realities of this is what you have to look at it specifically as a Black man and seeing how it's affected the African American community specifically. What we want to do is make a couple of decisions. One, you have to ask yourself, is there another job that I can find? Because if it's causing so much anxiety, you say, I can't go back to this place. Is there something else we can do? If it's anything we've learned through this, is how we can communicate from a technology standpoint. So you start talking about from a form of creativities. People are always looking for different times to move and to find something new to do that they were thinking about. So this is a time to be able to use those as an opportunity to transition and transform, if that is an option. Two, at the end of the day, what we have to say is this: what am I willing to risk? And if it comes to the point where you say, I'm not willing to take that risk, you need to be, again, like I said, talk with your supervisor, talk with the person who's in your office to see if you say, I don't want to change my careers, but to see if there's some way in which they can accommodate your position for you. If that is not the case, then you want to do exactly what's been stated before, to take the proper precautions to go in. And then if you see any of those signs and symptoms that's been associated with it, to seek medical help immediately.
Okay, after a family member is out and about driving and shopping, should the interior of the car be wiped down before someone who is immune compromised gets in the car?
I think that's one of those questions that it's impossible to answer with 100% confidence. That's the way the, can you hear me?
Yes.
That's the way the nature of medicine goes. Having said that, if you take the utmost precaution in ensuring that your hands are either you cleanse with alcohol-based disinfectant or washed before you start handling the interior surfaces of the car, then I think your risk is negligible, essentially. We do not know of any driver of this pandemic where clothes that have been in public places have gone into the interior of the car and then someone who's at risk getting into the car. So it's really those hands that serve as the biggest vector when we're talking about surfaces.
Okay, thank you. We have about 5 minutes left. Take us back to mental health challenges. We're getting a lot of questions about this. Firstly, what mental health challenges do you anticipate occurring post-COVID-19?
Increases in depression, anxiety-related disorders. I'm concerned about increase in persons with substance use or newly initiated substance usage, as well as concerns in terms of PTSD trauma, just feeling a sense of being traumatized by this entire event, as well as rises in domestic violence, as well as child abuse. Those are the areas that I'm very concerned about most.
And I think another area in which we don't speak about enough is specifically, you know, we are so congratulatory of the essential workers, which we need to be. They are doing a fabulous job. But when we look at the aftermath of what's going to happen to a lot of these individuals once this has slowed down, we're going to make sure that we have extra support for those who have been on the front lines, because when we talk about post-traumatic stress disorder, I think we're going to see that in an increase in those professionals who have served us so bravely at this point. So we want to make sure we look out for that population specifically.
I think mental health in general needs to be prepared for an uptick in all these and other diagnoses as well.
Okay, thank you. There's a couple of questions about the slides that we saw earlier being available. If you check the handout portion of the webinar panel, you should be able to click on a link and download that information. I'm going to try to squeeze 2 questions in here in our last 3 minutes. So firstly is, what kind of resources are available for Black and Latino communities after the pandemic is over? Prevention, education, long-term access to assistances, etc.
Yeah, so I can speak to that. I know Milwaukee Health Services is doing a lot of great things. MCW obviously is a great place where you can be able to go. The Office of Violence and Prevention, in conjunction with the Office of African American Affairs, are doing a lot of things to help spread the basis. But there's also a lot of different aldermanic districts that's working on this progress right now, and a lot of other different organizations. So you want to connect with all of the local churches, all of the local clubs, boys and girls clubs, things of that nature, and they will have a list of resources for you to be able to go to find out some of that information.
And finally, how do we take what we already know about trauma in various communities and connect families whose traumatic situation is exacerbated by the pandemic to resources differently?
Yeah, that's the million-dollar question. That's going to take more than the 1 minute that's left remaining. But what we have to do is recognize that those who have been traumatized by a system beforehand is going to be there. There's an old saying that's used in the Black community: when the white man has a cold, the Black man has a flu. But now we're learning what happens when the white man has a flu. So what we have to do is recognize that there's going to be a community that's going to need a vast amount more of resources that the COVID-19 has shed a great light on, by the disparities within that specific community, that population.
So I think mental health in general has to have an increased awareness. Our providers need to have an increased awareness, our schools, our communities, our churches, all of those support systems, in order to really help people access and link themselves to care and services.
Okay, thank you, panel. I'm going to turn it back over to Mr. Chris Miskell to close us out this evening.
Great, thank you. We had some really great questions tonight, so I want to thank everyone for the questions, and also thank our panelists for their time and their knowledge. Just a note that if we did not get to your question tonight, we're adding these to our FAQ on covid19.mcw.edu. Again, that's covid19.mcw.edu. We'll also add the mental health resources that we shared tonight and others to the community information page on the site. The next thing is that we're working with the 16th Street Clinic for Spanish language town halls, and those are being hosted virtually every Wednesday in April. This week, the time is shifted to 7 p.m. So we'll share a link with you for that. And then finally, we'll be doing another town hall next Monday at the same time from 6 to 7. So with that, I want to say thank you for joining us. We'll see you next week. Everyone stay safe and healthy. Thank you.
Thank you.